Hi everyone, this is Rick McDermott with Senior Solutions Group. Thank you for taking the time to check out this video. And if you haven't done so already and would like to, please subscribe to our channel so more people can get this important information. So we've discussed in previous videos when to enroll in Medicare, how to sign up for Medicare, how to pick the best Medicare supplement plan, or how to consider the best Medicare Advantage plan and prescription drug plans. I'm going to relay a story that happened about a week ago. A person found us online and called our number, and we did a phone appointment with them. And this person had turned 65 earlier in this year, and he told me that 2 family members told him not to worry about Medicare, that it's all taken care of. He didn't have to do anything. So he was on Social Security, so he automatically got his Medicare card and just put it in his wallet. And lo and behold, he started having some health issues. And so he calls us up saying, I need insurance for my Medicare and I need your help. And I think I got some bad advice from my family members. So the first assumption he did was to assume that he didn't need to do anything. That'd be like assuming that I don't need to change my oil on my car before I take a big trip. Or assuming that I'm going to buy this house and it doesn't need a home inspection. Well, anytime you take out a bank loan on a home, the bank's going to require an inspection. But if you're paying cash, you need to get that home inspected. So just taking the time to find an expert to inspect the home is similar to finding an expert to help you with Medicare. Because the government is not going to hold your hand and say, time's running short, you need to take care of this. So on our website at seniorsolutions.net, we have a link to enroll in Medicare and also to check out what your steps are. Now, there's some very important timelines you need to be aware of. When you have Medicare, you have the option within the first 3 months of the month after you turn 65. So if you turn 65 this month in July, you have the month of August, September, and October as months that you can actually take care of your Medicare options. Or you have 3 months prior to the month of July, so you have April, May, and June. If you're not on Social Security though, you have to actually apply for Medicare. And that's done through Social Security, either through their website or at a local Social Security office or over the phone with Social Security. So Social Security is the traffic cop for Medicare. You must get that done within that timeline. We're not tax accountants. The IRS gives extensions if you're late on your taxes, if you file for an extension. There are no extensions with Medicare. So people often say, well, that fall open enrollment window, that's like your tax season. Well, yes and no. We can't file an extension with the government, with Medicare or with Social Security. So in this person's case, he missed the 3-month open enrollment window to sign up for Medicare Part D drug coverage. So even though he's taking prescription drugs currently, he has no drug insurance. So we advised him to use GoodRx through the remainder of this year, and in the fall, between October 15th and December 7th, he'll have the option of signing up for either a drug plan, which is a standalone Part D drug plan, or a Medicare Advantage plan. So he didn't even have the option to look at Medicare Advantage for the remainder of this year because he missed his 3-month open enrollment window because he turned 65 in February of this year, where we're in July. So what we were able to do, however, was we were able to get him signed up for a Medicare supplement plan, which pays when Medicare pays. So think of the Medicare supplement plans as the glove that goes over the hand. So Medicare is the hand, the supplement is the glove. When the hand moves, the glove moves. So if Medicare pays any portion of your bill, whether it's at a ER visit or in the hospital, at a doctor's office, infusion care, medevac cost, if Medicare pays any portion of the bill, by law, the Medicare supplement plans will pay their portion so you don't go broke with medical bills, because medical bills can really add up. So the good news is we were able to sign them up for a Medicare supplement plan because by law you have 6 months to sign up for a Medicare supplement plan from your Part B, which is your outpatient part of Medicare, from the start date of Part B. So he's got a Medicare supplement plan but no prescription coverage, and he'll have to pay late penalties the rest of his life starting in 2023. So we can also review whether a Medicare Advantage plan would be an option for him to consider in the fall as well, but that is not an option because he is over his 3-month window to sign up for a Medicare Advantage plan and a prescription drug plan. All of that information is right in this book right here. If he had just read that book, he would have known. Well, how many people are going to read this book? So in seminars in years past, I'd hold that book up and say, how many of you got your Medicare New Book this year? And everyone raises their hand. How many of you have read it? All the hands go down except maybe 1 or 2 in the whole room. And then I say, keep your hands up if you've read the whole thing. And then that's when all the hands go down. Maybe one person will have read the whole book. And in the back of the book, there's going to be pages and pages and pages of plan options. You're supposed to sort through that on your own. If you don't have an agent helping you that you can trust, you're on your own. Or you can call 1-800-MEDICARE, sit on hold for an hour, and talk to someone. Or you can call the plan directly. So if you call an insurance company, it's like going to a Ford dealership. They're only going to recommend a Ford. They're not going to recommend a Chevy or any other car. So if you call an insurance company directly, they're only going to show you their plan. Whereas you call an independent agent, and hopefully you know an independent agent that you can trust. If you don't, feel free to reach out to us at Senior Solutions Group. We are here for you. We are licensed in multiple states, and we can help you navigate the Medicare. I'm going to call it for what it is. It can be a minefield if you don't do this right. So just like you have a manual in your car when you buy a new car, most people aren't going to read through that whole manual unless there's an issue. Sometimes you can open up the manual and you can fix whatever the issue is, whether you need to reset your change oil light, something little like that. But if it's a major issue, you may need to take it into the dealer. So think of us as your one-stop shop to help you with all of your Medicare retirement planning. We're here for you at Senior Solutions Group. Thankfully, our new client got a hold of us in the nick of time. If he had waited another month or two, his health condition would have excluded him from buying a Medicare supplement plan, possibly for the rest of his life. Also, if your Medicare supplement premium has gone up, and typically they go up 5% or more each and every calendar year, you can sometimes change your plan based on the state you live in with no health questions to save money. So we've been reaching out to our current clients all of this week and all of this month and all of this year, as a matter of fact, to help them save money. So if you're a client of ours, we're going to reach out to you to help you save money. If you're not a client of ours, or if you went straight through a carrier, they're not going to contact you and say, hey, do you know you can get the same plan for less money? So if that is you, reach out to us. We are here for you. Thank you for taking the time to check out this video, and have a great rest of your day.